My name is Shereen Hussein, as Cameron said, and I'm a professor of care and health policy evaluation at the University of Kent. I have been researching issues of aging and long-term care for over 20 years in the UK, Europe, and in other parts of the world, including the Middle East and North Africa region. It is really with great pleasure that I welcome you to the launch of the MENARAH network, which I'm leading, as Cam said. The network is really the fruition of considerable partnership building efforts across the region and internationally, which spanned over a number of years. The network aims to address the significant phenomena of population aging, which has direct and indirect implication in all segments of the society. Yet very little evidence is available to support developing tailored policy and effective practice solution in the MENA region. The MENA region, or the Middle East and North Africa region, comes with its richness, history, and mixture of political and socio-demographic positions. It spans from Mauritania and Morocco in the west to Iran in the east, Turkey in the north, and Sudan and Yemen in the south. It is quite a diverse group of countries. Yet they share several cultural and socio-demographic similarities. One fundamental similarity is valuing and respecting older people to the extent of treasuring older people. And while this belief exists, current infrastructures and health and care system do not facilitate translating such strong values into real experience of healthy and meaningful aging process. So the MENARAH network emphasizes the importance of healthy aging in its broadest meaning: psychological, physical, well-being, and social aspects. A core part of this is the creation of accessible opportunities for older people from various walks of life to participate effectively in more comprehensive social and economic activities. Such opportunities should acknowledge and attempt to counter the impact of cumulative disadvantages among different groups of older people. Research and partnership working are urgently required to establish sound knowledge base to enable system changes and to meet expected demands, while at the same time ensuring older people's well-being is at the core of any development. So the MENA region, along with many low and middle income countries, faces a number of questions, like what are the best models of care and support? How would they work for different groups of people? How can we support informal carers and their family? How to create a skilled cadre of workforce, health and care professionals who are skilled, but at the same time compassionate and proud and able to meet the complex needs, and how to finance these sustainably. So all these are very fundamental and complex questions that we hope the MENARAH network would be able to support developing answers and solutions to. The region is experiencing considerable economic, social, and demographic challenges. One of these is the simultaneous, fast, and steep growth in older age groups, while observing a youth bulk, with large cohorts of young adults requiring education, training, job opportunities, and housing, among others. So these challenges also create opportunities, especially in societies like the MENA region, where intergenerational exchange is part of its life fabric. Caring for older people in the region remains a family matter, particularly for younger women in the family, thus supporting the whole family unit and creating ways to facilitate intergenerational exchange and promoting women's contribution to the labour market and the wider society have positive and tangible economic and societal returns. In addition, older people themselves bring considerable benefits to the family and the whole society. Evidence from across the world shows that older people play an instrumental role in supporting younger generations, from financial help to in-kind support through, for example, much needed childcare or accommodation, or the endless emotional support. Older people also have valued professional and personal expertise. So creating opportunities for older people to participate outside of the family sphere would bring added value to the whole society. While all of these challenges require immediate actions, very little data and research are available to formulate, design, and implement effective policy and practice solutions. More importantly, what we find that the voices of older people themselves and their families is missing from all research. The MENARAH network aims to fill this gap and create mechanisms to facilitate much needed discussions, collaborative opportunities, and scientific research into the various aspects of aging and long-term care. We bring expertise from international and regional stakeholders with a specific interest in enhancing the lives of older people and their families. And we continue to forge strong relationships with relevant global, regional, and national bodies. One of the network aims is to build both research and policy capacity within the region and to facilitate knowledge translation into tangible responses, connecting all stakeholders, as well as raising public awareness. And really, our ultimate goal is to help creating an environment that enhances the quality of life of older people and their families in a fair and an equitable manner.